The first visit, you'll come into our office and we just have a conversation. It doesn't even have to be in a dental chair like this. We just talk about what it is you're looking for and what your goals are, and then we see if you're a candidate and we start putting together a plan. The second visit is where the magic really starts to happen. You'll come in for what we call records, and we take a lot of information. So we'll take a three-dimensional dental x-ray known as a CBCT, or a cone beam computer tomography image. We'll also use an intraoral scanner to take hundreds of images of your mouth, and we'll use some technology to overlay that three-dimensional x-ray with that three-dimensional scan. We also take several photos. You'll feel like a movie star by the time you leave our office. We make some other measurements as well, and we overlay that in addition to that material. So you're with us for about an hour. Behind the scenes, I take all that information, we overlay it, and digitally we plan out where the implants are gonna go, what the smile is gonna look like, every nuance and every piece that comes together. During that records appointment, we also talk about financing options in detail, and we help you find something that's going to work specifically for your budget and for your plan and your needs. We'll set up the next surgery visit as well. So the third time you come to see us is when you get your smile. You'll come into our office, we'll make sure you're comfortable, we'll give you a nice warm blanket, we'll give you some headphones and let you choose what music you want to listen to. We'll give you something to put over your eyes so you can take a nap if you want to, and if you really need some sedation options, we have that ready to go as well. During that procedure, we'll take care of any remaining teeth and infection that needs to come out. We'll put the implants in and we'll lock on that prosthetic for you. When you leave that day, we'll take a couple of photos, and there's usually some tears of joy from all of our ends because it just looks amazing. We'll see you shortly thereafter to make sure you're healing well. And interestingly, anytime I ask anybody how they're doing on a scale from 1 to 10 as far as a pain level, just with Tylenol and ibuprofen, nobody's ever told me that they're hurting worse than a 2. So it's really not a major issue. People say they'd rather go through that than have a headache in a lot of cases. So it's pretty amazing. Once that gum tissue has healed up, which really only takes about a week, you can kind of go back to normal. So we have you maintain a soft diet just to make sure everything stays happy and healthy. But as that tissue heals on the top, underneath, the bone is literally growing around those implants. I always kind of relay it to a fence post in the ground as cement sets around it. You're functioning and you're doing your everyday activities, but that bone is strengthening and hardening around those implants. After several months, you'll come back in and we're able to take that temporary locked in all-on prosthetic. We remove that and we'll have a final one that goes into place. It's very, very strong. This is the same material that crowns and veneers are made out of, so it's meant to look good and it's meant to last a long time. Our final visit together is we take a lot of photos again. We celebrate. Again, there's hugs, there's smiles, some tears of joy, and that's a fun appointment for everybody involved.